Taylor Swift's father who underwent quadruple bypass. There's a lot of discussion about recognition of heart disease and why he underwent the bypass because he had abnormal nuclear stress tests. Although in the past he's had normal EKGs or electrocardiograms, what prompts a doctor or a patient to engage in getting EKGs? When does a patient get a chance to do a nuclear stress test? And why would that prompt bypass grafting? You have resting EKG and then you have stress EKGs. So stress EKGs occur when you're actually exercising, like on a treadmill. When you do a stress test, the cardiac muscle, the heart needs more oxygenation. It needs to work harder. And that is when you start seeing EKG changes. EKG changes are sensitive but not specific. Nuclear study, they are given a radioisotope. Tracer is like a highlighter that gets injected to them and it lights up the heart. You can see rest and then there's stress images and we compare the difference. We look at the donut hole. If you see perfusion has gone down or blackened, you can then interpret that patient has a likelihood of a blockage. Regular checkups are really important because the more you look, the more you find. We understand the older we get, the more plaque we build up. And what I really recommend is everybody get a baseline cholesterol panel and understand if they have high cholesterol, and then get your sugar checked. Do you have diabetes? And for patients, in terms of asymptomatic screening, is something called the CT calcium score. For the most part, patients don't complain of chest pain. Chronic diseases, they present more of an energy decrease, feeling really fatigued, unable to perform activities that they used to perform about 6 months to a year ago. Were you able to weed, garden, bring the groceries in? Things that we don't think about as chest pain or chest discomfort, there are equivalents: shortness of breath, windedness, tiredness with physical activity that would elicit a cardiologist to think about if I'm dealing with heart disease.